We got a new study published looking at the effects of repetitive head impacts and the effect that they have on eye movements in young football players. The study looked at an eye movement called a saccade, which is basically a movement of your eyes whenever your eyes move from one place to another in a jumping type pattern. So if we were testing saccades, it would look something like this, where your eyes are bouncing side to side looking for a new target, as opposed to a smooth eye movement, which is what we call a smooth pursuit, which looks like this. We measure these eye movements in patients with concussion using technology like this, which is called a video oculography device. We basically put a mask on the person and we have them look at targets moving around, making their eyes move in different directions and measuring things like their velocity, their reaction time, and their accuracy. The goggles will transmit information about the eye movements and translate it into a graph that looks something like this, where you can see what the dot looks like on the solid black line and what the eyes are doing in this dotted line. For a normal high-functioning saccadic eye movement, what you'll see is that the dotted line and the straight line will basically superimpose on top of each other. Looking at the difference between the stimulus and what the eyes are doing gives us some valuable information about what the eyes are doing. So the three metrics that we typically look for a saccade are going to be latency, which is almost like a reaction time of the eyes to move to the target. We're also going to look at the accuracy, which is how close did it get to the target and did it make a correction if it made an error. We're also going to look at the velocity, which tells us how fast the eyes moved once it was able to identify the target. Those different components of a saccade can be related to different parts of the brain. For example, when we think of reaction time or latency, we tend to think of the frontal lobe, specifically things like the frontal eye fields. When we think of accuracy, we tend to think about the cerebellum because cerebellar pathology can make a saccade hypo or hypermetric, meaning they undershoot or overshoot the target. And when we think of velocity loss, then we tend to think of the brain stem where the burst generators for the saccades tend to exist. So this particular study took football players and he measured their baseline before a season, they measured them during the season, and he measured them post-season. And they did this across 2 seasons, which means that they were able to get data for players that played for 1 season. They also were able to get data for players that played multiple seasons. So the authors also put an accelerometer inside of their helmets so that they were able to measure how much head contact that they acquired throughout the season to see if they can make correlations between how much head impact did they take and how did that affect their saccadic eye movements. Here are some of the findings. The first one, which was not too surprising, was that the more head impact measured by the accelerometer, the more that their eye movements started to suffer, meaning that their latency started to increase, which means that they took longer to react to a target than the players that didn't take as much head impact. So you ready for the most striking part of this study? In the players that completed 2 years of the study, meaning they had the baseline of season 1, the postseason of season 1, and the baseline of season 2, what they noticed is that there was no recovery of their saccadic latencies between the postseason and the beginning of the new season. Their saccadic latencies, or their reaction time, was still suffering between the off-season. The other thing that's important to note is that these players did not actually suffer a concussion. All of these players were just going through repetitive head impacts from practice and in games, but they never had the clinical diagnosis of a concussion, meaning that these deterioration of the eye movements were from repetitive head contacts and not necessarily a clinically diagnosed concussion in itself. So a couple important points about this study is that these are measuring eye movements, which is just one metric of someone's brain function. We don't know if this has a clinical relevance, meaning we don't know if the decline in the saccades is actually going to mean a decline in cognitive or neurological function later on. But I think we could all agree that even though these findings represent a subclinical type of a problem, we could probably agree that seeing some form of brain function go down is probably not a good thing for someone. The decreased performance in saccades may be a risk factor for something like sustaining a new injury because your visual spatial awareness starts to go down, and it may be a cause for people to have other things like lower extremity injuries if they're going to be playing in sports for a long time. It's also important to note that saccadic latencies are somewhat modifiable with something that we measure in the office, that a patient can improve their reaction time with things like neuro-visual training and other aspects of neuroplastic training that we do in our office.